think we're almost ready to start. We'll see. Okay. All right. So hello, everyone, and welcome to our 10th installment of our Ask an Expert series. And in honor of National Nurses Week, I am thrilled to welcome our 3 guest experts who are all maternity nurses. With us today is Julie Blumenfeld, a nurse midwife at Capitol Health, Tina Figueroa, a labor and delivery nurse, also from Capitol Health, and Zara Zate, a postpartum nurse at Virtua Health. Welcome to all 3 of you and to everyone else who's joining us. Thank you so much for taking the time to be here. We have a lot of questions to get to, so I am going to jump right in. Our first question is actually for all 3 of you, and please take a moment up front to introduce yourselves and give us a little bit of your background as you answer. So the first question, pretty straightforward. How long have you been a nurse and why did you choose to become one? Julie, you want to kick us off?
Sure. So I'm a certified nurse midwife. I've been a midwife for the last 23 years, and I've worked in Trenton for the majority of that time. I'm also the current president of the American College of Nurse Midwives, New Jersey affiliate. In addition to my clinical responsibilities for a long time, I've been dedicated to serving the community. And I began my work in healthcare and my inspiration for wanting to be a nurse and a midwife working on community organizing and community-based health education projects in the Peace Corps, where I learned about midwives and the midwifery model of care. And I've really kind of kept that legacy. In addition to my hospital-based work, I continue to work in a variety of roles in nonprofit organizations in Trenton, serving at-risk infants, youth, and families.
Fantastic. Tina?
Hi, my name is Tina Figueroa. I went to nursing school. I graduated in 2004. My dream was to be a labor and delivery nurse. I was inspired actually by a midwife when I was pregnant for my first daughter. And I was just lucky enough to start my career in labor and delivery right out of nursing school in 2004. And I've been with Capitol Health ever since. I recently accepted a case manager position at our GYN office, our Ob Gyn office, but I still do per diem shifts at the hospital in labor and delivery.
Thank you. Zara?
You're welcome.
Hi, I'm Zara. I have been a nurse for coming on 6 years now. I actually started my background in med-surg, the medical surgical, and that was, the roughest 2 years of my life. But it was a great background for leading up to my dream of working in maternity. So when I was able to start working postpartum and nursery at Capitol Health about 3 years ago, it was honestly the best that I could ever hope for. I come from a family of nurses, but none of them are maternity nurses. So I was really trying to pave my own path. And thankfully I was able to find, the one kind of nursing that I really, truly loved. So now I currently work at Virtua. I've been there for a few months now.
Thank you all so much for your passion for your work. Nursing really seems to be a calling, and we are so grateful for all that you do. Our next question is actually for Julie. Julie, I wonder if you could describe your role as a nurse midwife and how you provide support to expectant and new moms.
So I'm a certified nurse midwife, and that means that I was a nurse before attending graduate school and obtaining a master's degree in midwifery. And since then, I've also completed a doctoral degree in nursing. And not all nurses that are licensed in New Jersey are nurse midwives. There are certified midwives and certified professional midwives, and we're all licensed to practice in New Jersey. But I am a primary care provider, and I provide a full range of primary health services for women from adolescence to beyond menopause. A lot of people think of the role of the midwife as attending births, but we take care of women in primary care, sexual and reproductive health care, family planning services, preconception care, prenatal care and childbirth, and the postpartum care. And in the midwifery model of care, pregnancy and birth are seen as normal. So the care is holistic, and midwives care for the physical and social well-being of the people they serve. And really the hallmark of midwifery care is the minimal use of interventions and the identification and referral of people with complications.
Julie, how does that differ from the care provided by an OBGYN? Just can you summarize that slightly?
Yeah, so as I mentioned, one of the hallmarks of the model is the minimal use of interventions and identification of referral. We provide a lot of individualized teaching and counseling, a lot of continued support during labor and during the postpartum period. And we are not supervised by physicians. Midwives are the lead professional in the midwife-led model. The physician-led model of care is typically focused more on pathology or illness, testing interventions rather than what's normal. And obstetricians are experts in disease and managing medically complicated pregnancies and birth, and they're also surgeons. The obstetrical model is generally more active as opposed to expected. So midwives are trained to focus on letting things play out naturally, which is safe and effective for the vast majority of people.
Thank you. I know that there is a lot of confusion over what the two roles mean. I think that clarified a little bit of how they overlap and how they're different. Okay, Tina, our next question is for you. When do you begin interacting with a mom, and how do you work together with an OBGYN or a midwife to help a mom through her delivery?
Okay. So usually when I'm assigned at the hospital, I do a lot of OB triage. That is when a mom comes in, we evaluate them. So if they come in for labor, we want to see if they're in labor, or if they're progressing enough to stay in the hospital, or if they need to go home and do some laboring at home on their own and then come back when their cervix is dilating some more. So as far as that question goes, I, as a triage nurse, I get to see the patient immediately when they come in and assess their situation. I'm very lucky to work with the doctors and midwives that I work with. We have excellent communication, and I feel like we're a team. And they respect our decisions and opinions as much as we respect theirs as doctors and midwives. So I'm very lucky to work with the team I work with.
Great, thank you. The experience of labor and delivery can be so overwhelming. It can really become a blur. So I am sure that information is helpful even for moms who have already been through that. Zara, as a postpartum nurse, you provide moms with information to prepare them for when they leave the hospital. Can you describe how you educate moms about their own postpartum care?
So ideally, the education that moms receive is starting from the moment they find out they're pregnant. It's not just me providing their care after they've had a baby. Ideally, what's happening is they're getting care throughout their pregnancy. They're receiving that education throughout, because the worst time to try and educate someone is after they've just pushed out a baby. Like, they're a little stressed out. They have a lot on their minds. So as long as when they have that good foundation, it's a lot easier for postpartum nurses and labor and delivery nurses and midwives and doctors to be able to educate and kind of give those tips and tricks of like how to handle those first couple months of having a baby and what do you do, especially for new moms. So, it's always very individualized based on the patient and what they need, both physically, mentally, spiritually, what could they need to support themselves throughout the care. And you just kind of read the room and try and help them out as an individual.
Thank you so much. As moms, we do so much to prepare for our little one that sometimes we overlook our own postpartum care. So that is really helpful.
For sure.
And listen, since it's Mental Health Awareness Month, I have a follow-up question for you.
Okay.
Pregnancy is already a stressful journey. And if you add the pandemic into it, the pressure and uncertainty a mom can feel can be enormous. How do you help moms cope with the stress of being a new mom? And what do you do when you notice the stress is actually maybe postpartum depression?
So like you said, having a baby in the pandemic is a very isolating time. And, you can have as much support as socially distanced as you can and whatever is comfortable for your individual family, but it is very difficult. So you're seeing many moms now coming in and they're just having a harder time mentally with trying to figure out, what am I going to do when I go home? Am I going to be able to have, that village to help take care of this baby with me? And you can see the stress on their faces sometimes. It's such a joyous moment, and it's also such like a what happens now. So most hospitals will go through the steps of making sure that we're evaluating these moms for postpartum depression. A lot of these hospitals, we provide a survey sort of just kind of a questionnaire of how you've been feeling. And that's sort of a very objective way of kind of just trying to evaluate what kind of help does this person need? Do we need to talk to a provider? What sort of resources can we give them? And sometimes, moms try to feel really strong about it because they feel like it should be the best moment of their life. But it's also, we have to be more open about mental health and more open about it's okay to get help. It's okay if you're feeling sad. It's okay if you're feeling stressed.
Well, I don't want to be the one to share your news, but you probably have a lot to rely upon, given that you yourself had a baby in times of COVID.
Yep. Yes, absolutely. It is much more relatable now.
Exactly. Anyway, so thank you so much for that. Our mental health obviously can be hard to talk about, but we have to change that because it is so critically important to our well-being and our overall health. Okay, another question for all three of you. How has COVID changed the way you provide care to your moms? We'll just use the same as last time. Julie, you want to start?
Yeah, so it really has changed things pretty drastically. We were just chatting before we went online about how, one big thing is that patients don't really know what we look like. We're wearing surgical hats and masks and shields over our faces. And so, just being recognizable to patients that have known you for years or patients that you may have seen recently and now they're, wearing a different mask. And so, just something as small as that, can make a difference in terms of relationship building. But I think that there's been a pretty big shift, even though, we've always been focused on social and psychological needs. Now it's needed more than ever. And things that may seem really basic, like food needs and childcare, have really come to the forefront. And then COVID testing, and where do you go for that? And now the focus on vaccines and explaining safety and vaccine safety, and lots of logistical issues about visitation in hospitals. And as we've seen nationally, for me, in working in Trenton, it's really highlighted more than ever the inequities that exist across communities, with so many of the patients that I care for in Trenton being exposed to and getting sick from COVID. And then, quite frankly, there have been some silver linings. And one that I can think of immediately is that the experience of the patient in the hospital has been a lot more focused on them. So even though I think that it's really, really hard for people not to have, everyone they want come and see them in the hospital, it's really shifted the focus to be very, very centered on the mom. She can have her partner, she can have her doula, which is special and important, but it really has, I think, highlighted how great it is for the attention to be focused on the mom in the hospital.
Thank you. Tina?
So I will speak about prenatally. So I feel that patients are not allowed to have partners or family members with them for ultrasounds and prenatal visits. And then, like Julie said, in the hospital as well. And I feel like that is upsetting to some patients because they want to share that moment with more than themselves and their nurse that is with them, especially for an ultrasound. In the hospital, they have one support person. It's a difficult time if the support person can't stay and they can't switch out people. So a lot of times after they deliver and that patient the support person has to go home to care for other family members, then they're there by themselves with their new baby, and they're not able to share that moment with, other family members.
Understood. All right, Zara, you're up.
I basically completely agree with what Julie and Tina have said. It, like I said before, it is very isolating, and there's definitely more of a shift on focusing on psychologically what do these moms need in this time, because you can see how vulnerable they are when they aren't putting up a show in front of all of their family that's coming to visit their new family, their new baby. They're being very honest, and it's very sad to see sometimes, but it's a lot easier sometimes to cater because they're kind of not afraid sometimes to just be like, this is what I need, like this is the help that I need, and they're kind of being more open in that way, which is nice. And the silver lining of yes, you can't have all these visitors that you want, but I can speak from my own experience being able to have a baby. And it was hard not to have my family come and visit me in the hospital like I dreamed, but to be able to have those 2, 3 days just with my husband and, just our little family unit and just really getting to enjoy this special moment with just us was really special.
Yeah, COVID has affected nearly every aspect of our lives. And I know a lot of the moms watching are very grateful for all the information you're sharing. So thank you so much. Zara, I'm just thinking, as I hear what you're talking about, I'm wondering if you might share your birth experience and any, tips that you might have had. And also, of course, please update us on how baby Nora is doing.
Yeah, so I had my daughter Nora on May 1st of 2020. So we were about 3 months deep into the pandemic. So it was a lot of unknown. It was a lot of, are we going to let dads come into the hospital and be there for, labor and delivery? And I remember that being like a huge, mental breakdown for me when I was, 31 weeks pregnant. Like, is my husband going to be able to even be there? And it was definitely a different kind of experience, and it's definitely helped shape how I see these moms, because it's very easy to forget that these moms are kind of going through stuff alone. But I thankfully had given birth at the facility where I worked at the time, and it was a beautiful experience. I was very fortunate that I didn't really have too many issues. It was a very smooth ride. And she's been a great baby. I mean, like a year old, and she's been sleeping through the night since she was 3 months. Like, hey.
Oh, so you're just making everybody feel badly if they
ask for help. Like, you need to ask for help.
It's a nurse thing. They know how to do that, right?
Yeah, exactly.
All right. Well, thank you so much for sharing. And obviously, I'm thrilled to hear that Nora is doing well.
Thank you.
Tina, I'm going to ask you a question now. Despite our Black maternal and infant health crisis, there are not many providers who are Black, let alone Black labor and delivery nurses. How can we increase the diversity of our providers to ensure that women see themselves reflected in the care they receive?
So that's a great question, and thank you for asking it. I feel like, as far as my part, being a role model on talking to the patients, being real with them, sharing your own experience, let them know that, you can do this as well. I was inspired by a midwife to become a nurse. I love the care that she gave me, and I felt very cared for in her presence. And I wanted to become a nurse because of her. As far as the community goes, reaching out to these patients, talking about tuition reimbursement and how ways that they can pay for school so they're able to go to school and accomplish their dreams.
Great. Okay. That is really helpful. Thank you. Increasing representation of people of color among our healthcare providers is something we must do to appropriately serve our mothers and babies of color. Okay, this next question is for Julie. Julie, how do nurse midwives help mothers have better birth experiences and better birth outcomes, especially mothers of color?
So midwives are trained from the very beginning. One of the very first things that's talked about in midwifery education is listening to patients. So we provide a wealth of education and engage in shared decision-making, which means we present information to patients and we share the facts and the recommendations, and then we listen to their needs and their perspective and together develop a plan of care for them. Research certainly supports that people cared for by midwives feel that they're better able to cope with their labor. They feel a greater sense of control over their situation because they feel heard. And as I mentioned, one of the hallmarks of the model is the minimal use of intervention. So in the midwifery model, typically you see lower rates of interventions, less artificial rupture of membranes, less use of things like episiotomies, less use of pain medications, and higher satisfaction with care. Additionally, midwives have lower rates of cesarean sections and higher rates of vaginal birth after having had C-sections. And midwives in the United States, the American College of Nurse Midwives and midwives within the state of New Jersey are working to diversify the workforce, knowing that research shows us that patients are best served by providers who look like them and come from their communities.
Thank you. That is information we really want to get out to the community so more mothers are aware of the role of a nurse midwife and what a nurse midwife can play and do for them in delivery. Okay, so we're coming up to our last prepared question, and it is for all three of you. But before I ask the question, I just wanted to tell anyone who might be watching online, if you have a question, please put it into the chat, and we will, if we have time before our 30 minutes ends, then we'll try and ask those questions as well. Okay, so what has been your favorite experience with a mom since becoming a nurse? I guess we might as well stick to our routine. So Julie, you're up first.
Yeah, that is a really hard question to answer. And I will say this, that on my hardest days where I've worked a lot of hours and I have stuff going on at home like we all do, and especially during COVID, and I think, oh my gosh, I just don't want to go to work. As soon as I step over the threshold or get into the exam room with the patient, it all just melts away. It is engaging and interesting, and the interactions with the patient just makes all of it incredibly worth it. And I mean it very sincerely. But really what stands out are just everyday victories, helping patients with limited access get prescriptions they need, or diapers, or a car seat, supporting moms that have a lot of challenges, or teen moms through really difficult labors and attending their deliveries, attending vaginal births after C-sections, which always feel like a huge victory for us and for moms, especially when moms have been told, this isn't possible, you'll never have a natural delivery. And then you're able to coach them and they're able to do that. Facilitating breastfeedings for moms and listening to people's stories of challenges and hardship, and amazing stories of resilience. Great.
Okay. Tina?
I have so many positive experiences, but one sticks out in my head. I had a patient, and this is years ago. She was, I think, 16 or 17 when she delivered her first baby. And then she came back many years later, and she said, "Do you remember me? I had a baby at the old hospital Mercer." She said, "Do you remember me? You inspired me with my last baby, and I am now going to nursing school." And she's due to graduate coming up this year. So that was very touching to me.
That's great.
Yeah.
Great. All right, Zara, you're up.
So I've been a postpartum nurse for almost 4 years. So, I mean, every birth that I've happened to see is always such a life-changing experience. But you would think that in those 4 years, I wouldn't have many repeat moms yet. But I mean, I remember the first time I had a repeat mom, and she came in and she was like, "Do you remember me? Like, when I had my first baby, you were still on orientation." And I remember you because you were walking around following the other nurse. And I was like, oh my God, I can't believe this is already happening. Like, I've only been here for 3 years. Like, what's going on? And then I just had another patient who didn't know what to name their baby. And they were like, "Oh, I really like the name Zara." And I was like, oh my gosh, like, please don't name your baby after me. But also, that's really funny if you do.
That is great. Those are really incredible stories. And I thank you, each of you, for sharing. Having a baby is an overwhelming experience, even if you've done it before, and even if you've read all the books and do as much research as possible. So I know it's reassuring for all of the moms watching to know that the medical professionals in the delivery room are not only experienced, but caring and passionate about their work. I don't see that there are any questions in the comments section. So, and I think we have just a minute. So I'm going to share a story with all of you, a personal story for me. And that is with our fourth child. And it's particularly relevant this week. With our fourth child, the obstetrician was actually got involved with a C-section delivering twins and didn't make it on time. And so my last child, who had a cord wrapped around his neck, was delivered by 2 nurses.
Oh.
So I will never
Crazy,
forget
yeah.
that. And, it's very relevant that I should probably say that about you this week. So from the bottom of my heart, I truly want to thank all 3 of you for being here and for what you do, and so generously taking the time to answer the questions. And of course, for all you do every day to support New Jersey's moms and babies. For anyone watching, please share this video on your own social media, because you never know who may be helping and who may need it. And as I said, this is our 10th Ask an Expert program. So please feel free to go back and check out all of our episodes. We have interviews with everyone from OBGYNs to nutritionists to lactation experts and more. And before I leave, I wanted to wish you 3 and all nurses in New Jersey a happy Nurses Week. Thank you all so much for joining us. Thank you to our doulas, our midwives, to our nurses, to all of you. Thank you.
Thank you.
Thank you.
Bye-bye.